The first step is to draw blood out of the patient's arm, 20 cc for this procedure. Following this step, we take the blood and we put it into the canister. Then we put the canister into the centrifuge and spin it, in this case for 15 minutes. After the blood is spun, you're going to get out a canister that looks like this with the plasma layer on the top and the platelet-rich plasma below it. So we're going to remove the platelet poor plasma from the top portion and discard that portion. Then we're going to take the platelet-rich plasma with a little bit of red blood cells on the bottom and resuspend it a few times to mix up the platelets and get them into our syringe, which we've added some numbing medicine to as well. Then we're left with about 3 to 4 cc's of platelet-rich plasma. After the skin has been prepped, we will begin the procedure by injecting into the area, in this case a lateral elbow, with sterile technique. We will then maneuver the needle around to try to find the optimum placement while looking at the ultrasound machine directly into the defect, in this case the common extensor tendon at the elbow. As we maneuver the needle around, we'll also be injecting some of the PRP mixture along the way, as well as doing some needling of the tissue to try to create a healing response in the tissue. When you look at the ultrasound view, you'll see the needle in, you'll see the bone on the mid portion of the screen, and the extensor tendon attaching right on top of it. You'll see the needle coming in, you'll see a gap right at the ECRB tendon attaches, and you'll see me needling that area and injecting some platelet-rich plasma along the way. We will fenestrate through the tissue multiple times during this procedure, as well as inject the medicine in different locations and pepper it up and down the common extensor tendon onto the bone until we are done.